Hi, I'm Krista. I'm a level 1 nursing student. Do you mind if I follow you around today?
Yeah, that'd be great. Thank you.
Okay, would you mind giving me the SBAR report on your patient?
Sure. It's Sinead O'Connor. She's in room number 231. She's 34 years old and she's a female. She has an allergy to trimethoprim sulfamexazole. She's full code, and the doctor that admitted her was Dr. Englehart. She's 177 pounds, she's 5'9", and her BMI is 26.1. Her primary diagnosis is fever of undetermined origin. Her secondary diagnosis is end-stage renal disease, and she was diagnosed with that 1 year ago. She has type 1 diabetes mellitus since age 8, and she has a history of recurrent UTIs, which we think is the reason why she came in here today. She has a pain level score of 4. She denies change in vision, hearing, and reports numbness and tingling in her lower legs. She has mild diaphoresis and a functioning AV graft that's clean and intact with thrill and bruit present. The cap refill is less than 4 seconds. She's positive for Perla, and her sensation is diminished in lower legs. She denies shortness of breath, denies recent colds. She reports quitting smoking 2 years ago, which is a great idea, and all lobes are cleared auscultation. She denies chest pain or palpitation. She reports elevated blood glucose over the past few days. Her normal dose of her medication controlling her diabetes mellitus is not working well with her. She has tachycardia, and her S1, S2 sounds are present. She has no murmur noted, and she has +1 ping edema in her lower extremities, and a 1+ pedal pulse in both feet, so it's a little low. She's on a renal disease diet. She's 1,500 milliliters fluid restriction. She reports a weight gain of over 10 pounds the last few weeks. She has a decrease in appetite, decrease in intake, denies abdominal pain. She denies change in bowel habits. Her abdomen is soft and round and non-tender, and she has bowel sounds in all 4 quadrants. Her intake recently is 375 milliliters, an output of 200 milliliters. She reports a decreased frequency and volume of urination. It's been darker and more concentrated.
Could you talk a little bit louder?
Oh, yeah.
Thank you.
It's darker and more concentrated urine. It denies pain, burning, or difficulty urinating with no bladder distension. So her vital signs recently was taken at 7:30. Her temperature was high, 101.1, which is partly the reason why she came in. We think that maybe she has a urinary tract infection along with the darker concentrated urine that she's experiencing. Her heart rate's 95, the O2 sat's 96, her blood pressure is 138/78, and the respirations have been 20. She had a urine analysis done, and it was a cloudy, amber-colored urine, and her white blood cells was high. It's 15. So that's why we think that she might have an infection. And so today we're going to be giving her imipenem and cilastatin. It's an antibiotic, and then we're going to give her continuous infusion of sodium chloride.
Okay, cool. Thank you. So I just had a couple questions.
Sure.
So why specifically is this client receiving this medication?
She's receiving this medication because she has the signs of the UTI, but it hasn't come back with a specific bacteria. We haven't had, so we don't know exactly what it was. So we're going to give her a broad spectrum antibiotic, and that should cover all the different possibilities of bacteria that she could be experiencing, and it has a bactericidal action, so hopefully that'll lower her signs of infection, such as her temperature and urine.
Okay. And what action does the medication have on the body?
The imipenem binds to the cell wall, which kills the bacterial cell, and the cilastatin is so it just doesn't get inactivated by her kidneys as quickly.
Okay. When should you question administering this medication?
She questioned it if she has an allergy to it, which I don't believe she does, but if she has allergy to cilastatin or imipenem. Also, if she has cross-sensitivity to penicillins or cephalosporins, would be another allergic reaction she could have to that. Also, she has kidney issues, so you want to make sure it's a safe dose for her kidneys. And
Okay. And does this medication have a therapeutic serum level?
No, it does not have a therapeutic serum level.
Which vital signs must be monitored?
You want to monitor all vital signs, but specifically her temperature since it's been high lately, and her blood pressure since she is hypertensive. So you want to keep checking on her blood pressure. And then also you want to be checking on her blood sugar since she's diabetic and it's been high as well.
Which physiological parameters should be monitored when the medication is being administered?
Well, you're going to look for signs of anaphylaxis first of all. You're going to look for lingual edema, and look for wheezing or like rash. You're going to want to, sorry, did you say what signs and symptoms?
What physiological parameters?
Oh, parameters, okay. Yeah, so you want to be looking at her urine since we think it's a UTI. Make sure it's not, look for like the cloudiness and the color and the amount of it. And also you're going to be looking at, her vital signs, her temperature and things like that.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
Well, you then want to make sure you're going to use standard precautions when dealing with IVs. And keep clean. You wear gloves. You don't want to use alcohol swabs on all the ports, and you cap those ports. You want to make sure the line's clear of all bubbles. You then want to make sure she knows to keep using her medication even if she feels better since it's antibiotic, and also to know the signs of infiltration and know the signs of anaphylaxis, like know to report like pain and swelling in her IV sites. Then we want to check the medication, make sure the bag's intact with no leakages, and make sure it's expired and not cloudy so the medication is safe. And that's pretty much it.
Okay. What are the side effects and potential adverse reactions?
It's going to be nausea, vomiting, diarrhea. Diarrhea is important to note because it could be signs of C. diff infection. Since it's a broad spectrum antibiotic, it could take out a lot of your natural flora, and that could open up a door for you having a C. diff infection. So they want to make sure the patient knows to report that if they're having diarrhea. And then also signs and symptoms of anaphylaxis if they're having an allergic reaction.
Okay, and how will you know if this medication is effective?
If the signs and symptoms of having an infection are diminished, like her temperature going down to the normal level, and also if her urination, if she's not having it being more concentrated, if it's more clear, not as dark, and things like that.
Okay. Thank you.
Yeah.
Those are all my questions for now.
Awesome. Would you like me to show you how I give Miss O'Connor her medication?
I'd love that. Thank you.
Okay, let me just open up the chart. Alright, so we have Shanann O'Connor open up in the chart. She is 34 years old, and she does have an allergy to trimethoprim sulfonexazole. And that shouldn't have, it's a sulfa drug, so it shouldn't have any interaction with the medication we're giving her today. So we're also going to check the doctor's orders with the MAR and make sure that is all adding up and it's the same. Okay, so yeah, she's receiving the antipenicillin piggyback. And that's 500 milligrams and 100 milliliters given over an hour. It's given at 6:30, and it's for Shanann O'Connor, and that's the same on the doctor's orders. And for the sodium chloride, it's the 0.9%, and it's given at 6:30. It's 30 milliliters an hour. It's going to be continuous IV infusion for Shanann O'Connor. And that's the same on the doctor's orders as it is in mine. Alright, so now we have the medication, make sure everything's right with that. We can go in and say hi to Shanann.
Okay.
Alright.
Sounds great.
So we're going to knock on the door and then enter. Hello, Shanann.
Hi.
How you doing? My name's Joe. I'm going to be your nurse today, and this is Krista with me.
Hello.
She's a nursing student, so I'm just showing her how I'm going to be administering your antibiotic.
Okay.
Alright, great. Alright, so first thing I want to do is wash my hands. Alright, Shanann, I'm going to be asking you your name, what's your name, and your, how old you are?
Shanann O'Connor, and 34 years old.
Alright, thank you, Shanann. And do you have any allergies?
I do to trimethoprim sulfonexidil.
Great pronunciation. That's exactly
Thank you.
Thank you. All right. So we already checked the allergies in the chart, so it's the same as the chart. It's not an allergy. So today, Shanae, we're going to be giving you the imipenem and cystatin antibiotic, and we'll also tell you some things about it before I leave. And we'll also be giving you your continuous infusion of normal saline, your sodium chloride, okay?
Okay, sounds great.
Alright, so I'll wash my hands and put on some gloves. So, dinner, our IV bags, and we're going to want to do our first check. So, the first one we're going to be doing is the sodium chloride, 0.9%, and it's for Shanann O'Connor. And what's your name again?
Shanann O'Connor, and 34 years
34
old.
years old, so that matches up. And it's going to be IV continuous, and it's given at 6:30, so it's the right time right now. It's 7:30. And 30 milliliters an hour, and do that. And also at the same time, I'm going to be looking to see if there's any tears. It's cloudy, everything looks good on it. The expiration date is 2018, so it's safe to give that. And then I'm going to be looking at doing our first check on the imipenem cystatin, and it's the imipenem cystatin, and it's going to be 500 milligrams and 100 milliliters in over 1 hour. And that's an IV piggyback, and it's for Shanann O'Connor, and like she just said, her name is Shanann O'Connor, 34 years old. Alrighty. So next, I'll just be opening up the sodium chloride. And so I'll just do the first check. So I'll use my scanner, and I'll scan her bracelet, their second check, I'll scan her bracelet. Beep. I'll type it in since our scanner's not quite working today. Comes up to Shanann O'Connor, so that's correct. And we'll scan our sodium chloride. Beep. Alright, and as you can see, it's a green light for the sodium chloride, safe for this patient. So next thing I'm going to do is I'm going to be checking on her IV site and flushing it. So have you ever had any complications or IV? Are you experiencing any pain right now?
No, I've had a lot, and I don't have any problems.
No problems? Okay. So I'm going to wipe it down for 15 seconds. Sterile, pop the cap off, sterile syringe.
Do you have any allergies? No, I don't have any allergies.
Twist it over, and then flush it. Are you feeling any pain?
No.
No pain. I don't see there's any swelliness. It's not tender at all.
No.
Okay. It's going good. And so I'll just leave that there. It went in perfectly fine. Except for I'll fix this cup. Went perfectly fine. And then I'll just clamp it. Alrighty. So I'll just leave that there so it stays sterile while I continue to hang up your IV sites.
Okay.
Alright. So now, I want to do first, actually before I hang it, I want to check the drug guide. And I'll be looking to make sure the N-pentomycin be safe to mix with sodium chloride. And yes, those can be mixed. And also, she has kidney issues. Is that right, Shanana?
Yeah,
Okay.
I have renal disease.
Okay. So I'm going to be checking if it's a safe dose for this patient. And it is. And it's supposed to be given intravenously, so it's perfectly good to give this medication to this patient. There's a lot of good information in this book. Alrighty. So for simulation purposes, this is going to be an unopened set, how we would use in the hospital. Make sure it's all entangled. Make sure everything, sure it's clamped prior. So now I'm getting to this step. I'm going to do my final and last check just to make sure everything's correct. So there's no complications for Marta. For Shanana. So let's hang this up. Alright, so it's sodium chloride, 0.9%. It's given at 6:30, so that's right time. It's given 30 milliliters an hour, and it's given intravenously. And also, it's for Shannon O'Connor. And what is your name again?
Shannon O'Connor,
How old are you?
34 years old.
And it's the right patient, so that's perfectly fine. So, we have our brand new vial flow, so that's all correct. And what we want to do is I want to flush it just to make sure everything's working on it. So make sure it's open. It is. I'm just going to flush it through. Perfect. So it's a new one simulation, but I'm just going to make sure everything's clean on it. So let's get these back. And I'm just going to wipe this down. 15 seconds. This side. And then it's going to be connecting to this end. So make sure this is sterile as possible with this now. Great. So it's all connected. It's open, because I'm going to prime all this at the same time. clamp it back, stop the flow, and then I want to just take this moment to check to make sure there's no bubbles in the line, because that's very important. And everything looks complete. Wonderful. So, before I do anything, I'm just going to set to 30 milliliters an hour before I clamp it. And just double check, make sure that's correct. Yep, 30 milliliters an hour flow rate. And, Chris, would you like to see it?
Sure. Okay, let me see. That's at 30.
30, wonderful.
Yep.
So I'm just going to right there. Connect. While I'm doing it, I'll just make sure it's Sinead O'Connor, age 34. And that's her name, right?
Yes.
Sinead O'Connor, age 34. And it's going to be sodium chloride, 0.9%, 30 milliliters an hour, do it at 6:30, and it's to be begun intravenously, continuously. So that's all correct. So, connect these. Alrighty. And now I can start the infusion. Set definitely at 30 milliliters, not right, 30 milliliters now, just sure.
Your name again? My name is Marta Young, and I'm 80 years old.
And it's dropping, so that's perfect. Alrighty, so this time I'll just do some documentation. Put down the time. Just make some comments.
Okay,
Make
can see that.
initials. Awesome. Cool. So next, I'm going to be administering the enapimsylstatin, and I try to check the expiration date. It's good. Everything's good. No tears or anything like that. So I'm going to pull it up. And did you say your name again for me?
Shannon O'Connor and 34.
Alright, and then I'll scan you. Beep.
Okay.
Shannon O'Connor. And I'll enter in the application. Beep. Awesome, and as you can see here, I got the green light. It's all verified, it's safe to get to the patient. And then let's do another check. It's going to be enapimsylstatin antibiotic, and it's given to Sinead O'Connor. And I see her here, her name is Sinead O'Connor, age 34, just told me. And it's given at 6:30, and it's at 6:30, and it's 500 milligrams and 100 milliliters, and that's to be infused over an hour. And it's given IV piggyback. Alrighty. thing first, and I want to lower the main set so it can effectively flow. Alrighty. So like everything else is a brand new set. It's all sterile, clean. So I'll take this. Pull the plug. Spike it. I want to make sure it's clamped. Perfect. So before priming, I'm just do another check. It's penicillin, imipenem celastatin, and it's 500 milligrams in a 100 milliliter bag, and it's 100 milliliters an hour. It's for Chanel Connor, age 34, and yet Chanel Connor, age 34, and it's given at 6:30, and it's given IV piggyback. So that's all good. So I'm just going to hand this. Excuse me, I'm just looking at this table. Try to aim at the trash can. Perfect. And just to make sure everything's nice and sterile, I'm going to alcohol swab it before I connect it.
Martha Young, I'm 80 years old.
Any allergies?
No, no allergies.
Swab this, and then I'm going to connect in this port, so make sure I swab this too. Wonderful. And just let me connect it. That's good. Before I open it, I'm going to be resetting the dial flow. And so it's going to be at 100 milliliters in 1 hour. So, as you see in the dial flow, it's got to set to 100 milliliters an hour. And could you check that for me?
Yeah.
There's
See, 100 milliliters.
1 hour. Awesome. And I did my full checks. So now I can just drop. Drop. Make sure it's dropping. Everything's working correctly. Yep. So everything's working correctly on that. So I'm just going to do some documentation at the time, take some comments and sign it. Make some additional comments. Then I'm going to sign it. so it's all saved. Medication. How are you feeling? Any pain? You're still calm?
No, I'm feeling good.
No pain? Okay, awesome. So I'm going to want to make sure I label my tubing with my initials and the date.
And I check with the pharmacy that they can give the medication at the same time.
Okay.
And I'm gonna do. To confirm, verify my secondary pen open and press start. So I open my pen. Yes. And I press start.
And then I'm going to be making you comfortable, Marta. Is there anything you need?
To 100.
No, I'm good.
You did? Okay. I'll just make sure I lower your bed.
And is my secondary
It's all the way down. That's nice and comfortable for you.
Uh-huh.
Alrighty, and here's your call light.
place.
And everything's fine, right? Everything, no pain
Yeah.
or anything?
I'm
Okay,
good,
awesome.
thank you very much.
You're welcome.
Be running for 1 hour, so I'll be back.
So, clean up the room a little bit.
So I can start.
And I'll also be giving you a little teaching, okay?
Okay.
So let's clean up your room a little bit.
This is your code. Let me know if you need anything. The baby's
Okay.
down. Do you need
So Marta, you just received psilocybin and imipenem,
side effects?
and that is,
I remember you said
it's
if
an
I-
antibiotic to try to treat your UTI. Urinary tract infection. Hopefully it'll help you out. It's a broad spectrum antibiotic. So some of this, do you know some of the signs and symptoms of it?
No.
Okay, so it's gonna be nausea, vomiting, and a big one is diarrhea, because it could be a C. diff infection, because it's a broad spectrum antibiotic because they're not completely sure what type of bacteria it is. So it might kill some of your normal flora, some of your normal bacteria inside of you. So that might open up a door for a C. diff infection.
Oh, wow.
It's nothing to get too worried about. Just if you have diarrhea, just let us know, and that way we can keep you as safe as possible.
Okay.
And then also, do you know about IV complications?
No.
Okay, so you might receive some pain and redness. It's not very common, but it does happen from time to time. So if you do have pain or redness or swelling in your arm, could you please let us know?
Absolutely.
Okay, thank you, Lauren. And then could you just tell me back what's the main important sign symptom to watch out for?
Diarrhea, because that could be C. diff.
Mm-hmm. Very good. And then just make sure you don't give medication to anybody else. Make sure you take all your antibiotics, because just because your signs and symptoms go away doesn't mean the bacteria goes away. And just be careful out in the sun. Maybe wear like sunscreen while you're on the antibiotic. And birth control. It does limit your options for some birth controls if you might want to use a bare form of protection while doing that, while using this antibiotic. Do you have any more questions for me?
No, that's really helpful.
Okay, awesome. And also I have a pamphlet on your medication, so you can review it on your own time. If you have any questions, we'll always be here to help you.
Okay, thank you so much.
Okay, you're welcome. We'll be back shortly to check on you, okay?
Okay.
No, you let it run. I'm not sure. You have to do that video again because that
Alrighty.
okay.
No, this is okay.
Okay.
Do you have any questions?
Yeah, I actually did.
Okay.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, there was. I wanted to make sure first that the client should be receiving this medication. So I looked at her chart to see if there's any signs of infection, which is her high white blood cell count and urine analysis, and also her dark cloudy urine, along with her temperature was high as well. So those are all signs of infection, which would be a reason for why she would get this medication. And then also I wanted to make sure she doesn't have an allergy to the medication. So I checked her chart, and she doesn't have allergy to that the psilocybin or penicillins and cephalosporins. So that's safe there. And those are the main ones to check prior.
Okay. And did this information affect your decision to administer the medication?
Yes, because I needed to be a therapeutic way to treat her infection that would be safe for her. She doesn't have any sensitivity to those medications, and it would be a good medication to give her.
Okay. And did this information affect how you administered the
As
medication?
far as how, no. I think that I would always just use the standard precautions for setting up an IV site, like keeping everything clean. I was very careful to clean all the ports, and in the hospital setting I would cap them after, of course, to keep everything nice and clean so there's no chance of infection in their IV site. And also, just doing my checks, going above and beyond just to make sure it's safe for my client.
Okay, thank you very much.
Hey, thank you. I'm just going to do some documenting on my teaching and the IV site that I checked. And yeah, you're welcome to watch me do that too.
Okay, thanks.
You're welcome.